today. Thank you so much for coming back for Lecture 3. This is a really important message that we're going to talk about today. We're going to talk about how heart health equals brain health. You cannot have a healthy brain without having good cardiovascular function. I want to teach you exactly how these risk factors affect your brain. And what really matters to me is teaching you how it is that you are going to take control over these risk factors. So just to take a step back for a second though, I want to remind everybody about why it is that we're together today. We are here because we are both incredibly interested in the brain. We want to know what is going on with this incredibly important part of our health. We want to know what to do. We want an expert to guide us, but it's been really difficult to figure out with all the information that's out there, what exactly is it that I'm supposed to be doing? In this lecture series, we go through 8 topics that are absolutely critical for successful cognitive aging, and heart health is maybe the most critical. So the first half of our lecture, I'm going to give you really high quality education about this connection between the heart and the brain, and in the second half, I'm going to give you evidence-based, scientifically valid recommendations for taking control of this aspect of your brain's health. So the first thing we have to understand is the heart-brain connection. Then we're going to go through high blood pressure, high cholesterol, and type 2 diabetes step by step to help you understand how these 3 very common conditions affect the brain. I'm then going to teach you how these 3 conditions join up together to cause vascular disease in the brain. So why is this topic important? It's important because if you're over the age of 50, chances are you've been diagnosed with one of these 3 biggies. Vascular disease disproportionately affects older adults. If you are over 50 or you care about someone over 50, you really need to hear this information. Like all aspects of brain health, it's that intersection between genes and lifestyle, what we can't control and what we can control that result in our health. But unless we know what these risk factors are and unless we know how to protect ourselves, we're kind of in the dark. We don't know what to do. In 2012, the very first international conference connecting up heart health and brain health was held in Paris. And since that time, there's been a huge interest in vascular brain health. We need to understand how is it that the brain's fuel, oxygen and blood, gets delivered to the brain. The primary method is through the vascular system. The spokesperson at this Paris conference concluded by saying that if adults only recognized the significance of heart health on brain health and took steps to control these risk factors, we could dramatically reduce the incidence of dementia worldwide. Okay, so let's start by understanding the cardiovascular system. It is a network that runs through our entire body. You can kind of think of it like flexible tubing that brings the main fuels back and forth. The system is made up of veins, arteries, and capillaries that bring blood to and from the heart. It circulates and transports nutrients, oxygen, glucose, and carries away waste throughout our entire body. Our cardiovascular system provides us with the nourishment that our body needs to live and to live well. It gives us the nutrients, it carries away waste, it stabilizes our temperature, and it brings the vital ingredients that we need in order to survive. As I taught you earlier, the brain requires a lot of the body's oxygen and glucose, and the primary way that this fuel gets into the brain is through the vascular system. That's why it's so critical that you understand it if you're truly going to achieve brain health. So there's 2 types of blood vessels that supply the brain. We have 2 really big systems that come up in the front and in the back. The ones in the front are called your carotid arteries. You've probably heard of those. The ones that come up in the back are called your vertebral arteries, and these are the really big guys. These are the ones that you could actually see with the naked eye if you were to look at someone in autopsy. All of these blood vessels join together in the middle part of our brain in something called the circle of Willis. Now, this is an incredibly ingenious thing that nature has done to us because it's really a compensatory system. Because if you develop a problem in one part of your blood flow, there's all sorts of other ways that the blood flow can get to that same spot. In other words, there's backup. Now remember, I said there's another type of brain vessels. These are the much smaller blood vessels. These are the ones that have start points and end points that are independent. They are not connected to other parts of the brain. These are one-way streets. These are very fragile, very delicate blood vessels, and they happen in the middle part of our brain, in the white matter that we learned about a few lectures ago. This is the core of the brain where we essentially go out and find information and bring it back into our awareness. Even mild vascular disease in this part of the brain can give us difficulty with retrieval. This is the basis of what a lot of us consider to be quote unquote normal aging. You know that feeling when you know the person, but you cannot think of their name, or you see that movie and you know darn well who that actress is, but you just can't call it up, and 2 hours later it pops into your memory. It's almost certain that it's because of a little bit of damage in this part of the brain. So how does that damage get there? It's almost always due to high blood pressure, high cholesterol, and type 2 diabetes. And we have to understand how that damage happens in order to try to stay ahead of it. Now, the bad news is once that damage is there and these little tiny blood vessels are all filled up with cholesterol and they're under pressure from high blood pressure and they break off, there's no way to undo that damage. There are no medicines that treat this condition. So prevention and stopping the progression once we know it's there is absolutely critical to brain health. So I want to introduce you to a new term. So when we talk about the vascular system in the body, what we're talking about is the cardiovascular system. Once we cross over into the brain, it has a new name, and it's called the cerebrovascular system. So I'm going to be talking to you specifically now about vascular risk factors that are known to affect the health of your brain. The first cerebrovascular risk factor that we have is age. Typically, we think of about the age of 50 as being the turning point for when people start to develop difficulty with circulation and blood flow. Now remember, one of the themes of this program is that normal aging should really result in mild changes. So we're not talking about big dramatic changes, but just like mild changes happen to the overall health of the body, to the health of our eyes, little mild changes do also happen in the health of our blood vessels and in our brain. The next biggies are the 3 ones we're going to focus on today, but I do want to tell you a couple other ones as well, just so you're aware of them. Probably after high blood pressure, also called hypertension, high cholesterol, and type 2 diabetes, I would say that untreated sleep apnea is the 4th highest contributor to cerebrovascular disease. And what I mean by cerebrovascular disease is not enough blood and oxygen being able to get to the brain because those little tiny blood vessels are all clogged up, or they've broken off and they've died. Untreated sleep apnea is a very, very big problem. It's almost a public health epidemic. Many people have it and don't know it, so of course it's not treated, but a lot of other people have it and cannot get with the treatment, which is the CPAP program. Some people have something called a BiPAP, but most people have a CPAP. If you're one of these people, or you know someone who has this condition, meaning you stop breathing multiple times in the night, I really want to encourage you to tell that person that every year they come out with new advances in the appliances that are built to be more comfortable and more user-friendly. Sometimes I'll see patients and they'll say, well, I tried that 10 or 15 years ago and I felt like I was wearing a gas mask. I'll encourage them, please go back to your doctor, please try it again, because it's just that important. One of the lectures that we have coming up is all about sleep, and I have so much to tell you about sleep apnea, but I'm going to save it for that time. The other thing that can affect the quality of the blood that gets to the brain are things like too much alcohol, atrial fibrillation, smoking, not enough exercise, and poor diet. Another risk factor for vascular disease in the brain that you might not be as familiar with is stress. Stress hormones wreak absolute havoc on our immune system, which is absolutely critical for optimal brain health. Again, I've got a lecture in the future all about stress. It's such an important topic, it deserved its own hour. So let's get into these 3 common vascular risk factors that affect brain health in detail. The first one I want to talk about is high blood pressure, hypertension. And why this is at the top is because it is the most damaging medical diagnosis for the brain. What is high blood pressure? Many of you have it, but you actually don't even know what it is. You just know, is it either good or is it bad? What blood pressure is the force of the blood that's moving throughout your body. The reason that blood pressure can get very high is when there are obstructions in the blood vessels that the blood flow has to move around, the velocity has to pick up, the speed has to pick up. And when we have high blood pressure, that's exactly what those numbers are indicating, is that for the blood to move through properly, it has to get faster and faster and faster in order to move around. We typically think of optimal blood pressure as being 130/80. If you're over 60, I want you to pay more attention to that upper number, the 120 of the 120 and 80, because the higher this number gets, it means that the arteries flowing into your heart have stiffened, meaning that the blood flow probably throughout your body is less than optimal. So I want to talk to you a little bit now about high cholesterol. Then we're going to talk about type 2 diabetes, but where you really need to pay attention is how these three things come together. Like I said before, think of how many people don't just have one of these conditions. They either have two or three, and that's because they travel together. When you have one, you're so much more likely to have the other. So let's talk about high cholesterol. I think many of us know what cholesterol is, right? It's a waxy, fatty substance that streaks on the inside of our blood vessels. What sometimes people forget is that we need a certain amount of healthy cholesterol in our body to build cells. This is why a fat-free diet makes no sense at all. We absolutely need fat in our body for it to work properly. And this is especially relevant for the brain. If you remember when I taught you about brain cells, I told you that there is a nucleus at the top, and then there's a long skinny tail that's covered in myelin, which is fat, and this is the main conductor in the brain. If you don't have an adequate amount of fat in your diet, you're going to have some transmission problems. For many people, there is a genetic involvement, but it's also very heavily dependent on lifestyle, specifically diet and exercise. And why this matters is because when there's obstructions in a blood vessel, the blood has a harder time flowing through, and this is where high blood pressure typically comes in. So remember, just a few minutes ago, I said the blood pressure is all about the speed at which the blood needs to move through the artery in order to get to its destination. If there's roadblocks in the way, it has to go a lot faster to get around those roadblocks. Those roadblocks are the cholesterol. So you probably know we have two types of cholesterol. We've got the good kind and the bad kind. Cholesterol moves throughout the body in proteins called lipoproteins, and we either have high density proteins or we have low density proteins. And this is where we have the breakdown of the so-called good and bad cholesterol. The LDL, or low density lipoprotein cholesterol, is the bad stuff. That's the stuff you don't want in your blood vessels. This is the stuff that leaves the long fatty streaks that makes it hard for the blood flow to get through. The HDL, or the good cholesterol, is the high density lipoprotein. This is the one that we need that's critical for cell development and growth. The idea with HDL cholesterol is that it moves all throughout your body, picking out the bad cholesterol and brings it back for the liver to get rid of. As we age, there are no absolute cutoffs between normal and abnormal cholesterol levels. Recommendations are made specific to the person, taking into consideration all of their medical history. So it's really important to talk to your doctor about what specifically applies to you or someone you care about. Now, I know one question that is on your mind out there, if you have high cholesterol, is statins. What am I supposed to do with statins? This is a very controversial area, and I want to give you my 2 cents on it. The scientific literature is very clear that statins are immensely beneficial. There is a subset of patients that feel strongly that statins do not work for them and that their memory has been negatively impacted by statins. There have not been enough good quality studies to make a sound scientific recommendation on this. I think it's very personal and you need to speak with your physician again. But my personal opinion is that what the science says is that the benefits of statins far outweigh the risks. So for me personally and people that are close to me, I tend to recommend that they stay on those medications. Let's talk about another very common age-related vascular condition, type 2 diabetes. When the sugar levels in our blood rise higher than is normal, our insulin system cannot keep up, and this is what insulin resistance is. Over time, damage to the pancreas happens and people develop type 2 diabetes. We need to talk about the 3 different ways that type 2 diabetes negatively affects the brain. Inflammation is concerning because it narrows the blood vessels. Remember, this is a critical concept. The brain needs oxygen and glucose in order to work. The way it gets those fuels is through the blood. Blood travels to the brain through the blood vessels. If the blood vessels are narrow, if they're diseased, if they're not able to work properly, the brain is running on empty. It's important to remember that brain cells cannot hold on to oxygen or glucose. They have no ability to set up a reservoir system. So what we need is a constant, steady supply of the fuels of the brain in order to think properly. The part of the brain where we make our memories and learn is called the hippocampus. We have one on both sides of our brain. This part of the brain is incredibly sensitive to very high peaks in blood sugar and very low dips in blood sugar. This is critically important for people with diabetes to know. Physicians understand that it's a little bit better if you tend to run a little high in your numbers or you tend to run a little bit low. What the brain does not like at all, and where you really see damage to memory, is when there's big swings in blood sugar. Let's just say one day someone's at 280. The next day they're down to 40. That's when I really get concerned as a neuropsychologist about my patients with type 2 diabetes. The stability of the blood sugar that moves throughout our brain is really, really important. So let's talk about how these risk factors come together to result in a 4-step process that can really lead to disaster. The first thing that happens is we see damage to the internal lining of the blood vessels due to too much pressure. So what happens is when the blood pressure goes up really high or it vacillates really high and really low, is that these fibrous caps can come loose from the internal lining of the blood vessel and move downstream, resulting in one type of stroke called an ischemic stroke. Your risk for stroke is significantly higher if you have one of those 3 cardiovascular problems. Now, this is a really, really important point. The more damage you start to get from these different blood vessel changes, the harder it makes it to take care of yourself physically and medically. So what do I mean by that? If you are somebody that you know has type 2 diabetes, you know better than me, it is a chore. It is a lot of work. There's monitoring, there's a journal, you're writing down, you're watching your foods, you're checking your sugars. It's a lot to do cognitively. So remember, these problems cause difficulty with thinking in the brain. So we have people that are needing a lot of cognitive skills to manage this medical condition, but maybe they're actually having trouble managing it because of the damage that's already been done. So we're actually asking these people to do something that might be very difficult for them. When a person has all 3 of these risk factors, scientists think that it reduces their lifespan by about 19 years. So let's move a little deeper in our understanding. So we know that these 3 risk factors can come together to damage the vascular system. Let's talk about that a little bit more in depth. So what matters is where in the brain the damage happens. What are the specific blood vessels or the system of blood vessels where this problem happens? Is it happening in the 2 biggies in the front, the 2 biggies in the back, those small little guys that live in the middle? Brain scientists understand what different parts of the brain do. Depending on where these changes have happened in the brain, people are going to get different types of symptoms. The smallest blood vessels throughout the body are at greatest risk. We talked before about where these smallest blood vessels are. They're in the feet, the kidneys, the eyes, and in the brain. And I think that it just makes sense if you think about it. When we think about heart disease, we think about people who have problems with their heart. We think about people who've had heart attacks or maybe even have needed something called a stent. What that means is that one of the blood vessels in the heart has gotten so clogged up that they have to go in and manually open it up. So if that's happening in a blood vessel that's so large you could see it with your naked eye, what is also happening in the parts of the body where there are the smallest blood vessels? The smaller a blood vessel is, the less elasticity that it has, the less room it has to grow and accommodate these cholesterol deposits. And remember what I said about those teeny tiny little blood vessels in the middle part of the brain. They're the end of the road. There's no other blood vessels to come in and help compensate. So when those little tiny blood vessels in the middle part of the brain get clogged up and break off, there's really nowhere else for that brain tissue to get its fuel. One rule of thumb that I want you to keep in mind that brain scientists know is that what happens in the eyes and the feet tends to happen in the brain, and it's all related to the diameter of the blood vessels that feed those organs. The most important thing for you to know is that early diagnosis and treatment of these three conditions is absolutely critical. Remember before I said there are no treatments to reverse this damage, but once you are educated about the effects, you can absolutely keep it from getting worse. The way I want you to think about cerebrovascular disease, so this is vascular-related disease that happens in the brain, is on a spectrum. And what we're going to talk about is the least significant, the least severe, all the way up to the most damaging. The first one we have is called chronic ischemic small vessel disease. The second one is vascular-related cognitive impairment. The third one are TIAs, or transient ischemic attacks. The next one is a stroke. And the final one is vascular dementia. So I want to get you up to speed on what all of these concepts are. The first one is quite a mouthful, chronic ischemic small vessel disease. If that wasn't bad enough, it actually goes by many other names. It can also be called age-related vascular disease, lacunar infarction, small vessel disease, white matter disease. And we've been talking about this throughout this lecture. Remember, these are those tiny little blood vessels that once they're gone, there's no getting them back. It's a very common finding in brain scans. If you had to have a CT scan of your head or an MRI of the brain recently, there's a very good chance that they found that you have some degree of small vessel disease in your brain. This is actually normal after about the age of 50. What I care about when I read an MRI or a CT report is what is the degree of small vessel disease. The reason that some adults have a higher than normal amount of small vessel disease is because over time, there's been a slow but gradual decrease in the amount of oxygen that's been able to get to that part of the brain. The relationship between the degree of severity of small vessel disease and everyday functioning is an area of controversy within brain science. There's been a lot of papers back and forth with some people feeling that it doesn't impact upon everyday life and cognition, and other people feeling strongly that it does. Some scientists believe that we don't really even understand what normal brain aging is because all of the older adults that we've been using as so-called controls in research studies have small vessel disease, and this is in large part related to Western culture, the idea of diet not being so great and being fairly sedentary. Vascular cognitive impairment is more cognitive problems than we would expect for age, but not at the level that it interferes with everyday functioning. Because the small little blood vessels in the brain are the ones that are most affected, what you see in everyday life is actually difficulty with the frontal lobes because that part of the brain is connected on a circuit to the frontal lobes. What our frontal lobes help us do are things like plan for the future, organize our behavior, and multitask. From a behavior perspective, they also help us get interested in something and also hold back when we're feeling maybe a little bit feisty about something. So what you can commonly see in people that have vascular cognitive impairment is a little bit of impulsivity and more difficulty switching back and forth between tasks. People with vascular-related cognitive impairment are still independent in everyday life. They drive without problems. They remember to take their medicines. They can manage their money. Remember, that is our line between cognitive problems and dementia. Let's talk about transient ischemic attacks, or TIAs. Remember that T is very, very important. The word transient is critical to this concept. The idea is that this is related to a temporary block in the blood flow to the brain. If you scan the brain of someone who's had a TIA, you should not see any evidence of brain damage. And in fact, after 24 hours, any of the symptoms that the person experienced should really have gone away completely. Most symptoms last about 5 minutes, but sometimes people can have TIA symptoms all the way up to an hour. Mini strokes are very important for us to talk about because many people only find out that they've had them once they've had a brain scan. The term mini strokes and silent strokes are used interchangeably, and I think that can get a little confusing for people. Mini strokes are 10 to 20 times more prevalent than what we think of as strokes, a sudden onset of symptoms in our body, symptoms in our senses, symptom in our cognition. 31% of people over the age of 60 have had a mini stroke, and up to 50% of folks over the age of 75 have had one. About 30% of people over the age of 65 have had a TIA, and up to 40% of people over the age of 70 have had one. It raises the risk for both a future TIA and a stroke. The chance of having a stroke approximately doubles for every decade you are over the age of 55. It's the most common type of brain disorder, with over 15 million people in the world having had a stroke. It's the leading cause of serious and long-term disability in the United States. It occurs when blood flow is interrupted in a part of the brain. Stroke occurs when blood flow to a part of the brain is interrupted. There are two types of strokes. The first one is ischemic, and the second one is hemorrhagic. Ischemic happens in about 80% of people that have strokes, and what that term refers to is a blockage. It means that something got in the way of blood flow getting from point A in the brain to point B. A hemorrhagic stroke, which happens in about 20% of folks, is related to too much blood in the brain. So ischemic, not enough blood; hemorrhagic, too much blood. And what you typically see is that the hemorrhagic strokes or bleeds are related to high blood pressure. And the idea is that the blood vessels, specifically those that don't have any collateral support around them, can only take so much pressure before they rupture. And then we've got a secondary problem, not only a damaged vessel, but now we've got blood in the brain. Blood in the brain is very, very caustic. The brain is very unhappy when there's blood in it for two reasons. The first one is that the brain is contained within a very finite cavity of the skull. There is only so much physical space. Now, the brain is amazing in many ways, but one of the ways it's amazing is it can actually contort itself and move to accommodate for extra fluid or extra structures that are in the brain. The problem is that this is also finite. It can only do that but so much. And the problem that we have with blood in the brain is when there is too much, what happens is the brain tends to herniate, which simply means that it goes back on itself and you get a compression of the brainstem, and that's how people can have sudden death with strokes. Now let's go to vascular dementia. About a third of people who've had a stroke wind up meeting criteria for vascular dementia. Now, vascular dementia is one of the only kinds of dementia that you do, by the books, need a brain scan in order to diagnose. And that is because technically you should have evidence of at least 2 strokes to meet the criteria. But you also need to have that neuropsychological evaluation. You need that paper and pencil cognitive testing to know, are these deficits that the person has in terms of thinking and memory significant for that person, and are they interfering with everyday life? There are no FDA-approved medications to treat vascular dementia. What we think about is, how do we keep these people from having an additional stroke, and how do we help make the rest of their brain healthy? What you have to remember about a stroke is that in the brain, it is a somewhat isolated event. Now, of course, this isn't true for everyone, and the younger you are, the truer this is. But for the vast majority of people with strokes, it's the part of their brain where they didn't get blood flow that is the problem. The rest of the brain can actually be functioning quite well. So we need to teach people how to keep the rest of their brain healthy, and also teach them how to compensate for the problems they're having related to stroke. Now we're going to transition into my favorite part of the lecture, which are the recommendations. The first thing that I want you to do, and this is a theme you're going to hear me say over and over, is you have got to take control of your health. You have got to know your numbers. Do you know right now, for example, what your blood pressure has been? Do you know what your blood sugar has been running? Do you know your cholesterol? If you've been to a primary care physician recently, they've probably done a blood test and have a measure of your overall blood sugar health called your A1C. Do you know what that is? Okay. What I want you to do is start to use our companion workbook to ask your doctor for this information and start to keep track. This is the first change that I want you to make. I simply want you to know more about what's going on with you now. It's so important to take your medication exactly as prescribed. If you're not using a pill box, you absolutely have to get one. They're super cheap at the convenience store, and it's just a great way to be able to stay on top of it. Some people forget a few times a week. Sometimes they double up, not remembering that they've actually taken it. And both of these scenarios are very concerning to brain scientists. Many older adults wind up in the emergency room from overtaking medications. However, there's definitely dangers associated with not taking your medications exactly as prescribed. In my previous job, before I started my private practice, I worked on an inpatient stroke unit, and I was absolutely amazed at how many people were in there for strokes after having forgotten to take their medication just for 2 days, or having gone on a vacation and they forgot to bring their pill box. It's something that's such common sense, but sometimes we just need to be reminded of how absolutely critical it is to stay on top of our medications. Another tip that can be really helpful is to always use the same pharmacy when you get your medications. I know nowadays some people get them online. You might get a few at the VA. Other times people get them at different pharmacies in their community. I would really encourage you to use the same pharmacist over and over again. Pharmacists are wealths of information, and it's really their job to stay on top of drug interactions. One of the problems I think we have in medicine today is we can have too many cooks in the kitchen. We have a lot of specialists and not many people that bring it all together. Sometimes your doctors don't know who else is prescribing something. Maybe there's something where there is an interaction, or maybe there's 2 blood pressure medications. In 2010, the New England Health Initiative came out saying that using a pharmacist is your best bet at reducing dangerous drug interactions. But what's important to recognize is that medication adherence is lowest in people with chronic disease. And what is chronic disease? It's the 3 things that we talked about today. These are the most common chronic diseases: high blood pressure, high cholesterol, type 2 diabetes. Only about 50% of adults who've been diagnosed with high blood pressure actually have it under control. So this tells me that we've got a lot of educating and motivating to do better. The strongest scientific support for how to stay on top of these medical conditions is hands down cardiovascular exercise. The recommendation currently is to strive for at least 3 days a week of 30 minutes of rigorous exercise to the point where you at least start to break a sweat. Now, one thing I always like to emphasize here is when I think of exercise that's good enough for the brain, I don't mean that you need to go out and work with an expensive trainer. You actually don't even need to join a gym. You just need to be more active tomorrow than you were today. Things like walking are actually incredibly effective at improving brain health and overall circulation. A recent study came out showing that 10 minutes of walking every day after dinner was just as powerful, just as effective as walking 35 to 45 minutes. So you really don't even need that much time in order to get the benefits from exercise. But what's really important is that you make it a part of your everyday, and it has to be something that you actually enjoy. If you look at it like a chore, it's not going to be something that you fall into a new habit with. You have to find something that you actually derive some kind of pleasure in. A study came out a few years ago that suggested if Americans would just become more participatory in cardiovascular exercise, that we would reduce the incidence of heart disease by 30 to 40%. Exercise helps the brain in 2 ways, both directly and indirectly. And I think the more you know about these benefits, the more you're going to be motivated to make these changes. The direct effects are all related to blood flow. It's all related to circulation. It reduces blood pressure. It gets rid of that bad cholesterol. It improves your good cholesterol. It helps the elasticity of our blood vessels, so we're more able to move that blood all the way throughout the body, including those teeny tiny little blood vessels in the brain. And maybe the coolest part of all is that there's research that shows that cardiovascular exercise can actually help to grow new brain cells. Now, indirectly, you're also going to get a lot of benefits. Exercise is an amazing sleep inducer and stress reliever. Also, a lot of us exercise with other people, which really is ideal because then you're getting those social health benefits as well. A very important recommendation is related to diet. And again, because this is so important, we're going to have a whole lecture on it in the future. But the key is related to inflammation. And again, I don't want to sound like a broken record, but it all comes back to your circulation. We've got to open up these blood vessels. So the idea is that you want to try to eat more whole foods than processed foods, okay? One really good rule of thumb is to try to reduce or totally eliminate any foods that come in a box. That's a great rule of thumb. But you're going to find when you go to the grocery store that that's a lot easier said than done. You want to try to eat foods in the closest to their natural state as possible, because then you have all of the enzymes, all of the tools that your body needs to break down that food to get the most nutrients. You want to make sure that your diet is high in fiber, low in saturated fats, and low in sugar. You want to make sure that the liquids that you drink are natural. Soda is probably one of the worst things. There's some new studies coming out that show that diet sodas in particular may raise our risk of dementia. And just as a general statement, my thought is that it's best to get most of your vitamins from your food. Again, we're going to talk about this more in the future, but I think the body is very, very smart. And unless you have an identified vitamin deficiency, like a vitamin B12 deficiency or an anemia or vitamin D, I think that most people are wasting their time and money on vitamins and supplements. So let me inspire you with 3 ingredients that scientists know truly improve the vascular health in your body. The first one is flax seeds. The second one is blueberries, and the final one is whole grains. So if you think creatively, I think you can put all of those together to actually come up with a great breakfast as a way to start your day. I want to tell you a little bit of the scientific basis behind those 3 recommendations. A study just came out last year showing that ground flaxseed in anything from muffins to cereals had a very dramatic reduction in high blood pressure, specifically on postmenopausal women. And in fact, the authors concluded by saying that this was the most powerful food-based intervention that had been published in Science. Another study looking at women aged 45 to 65 looked at the power of blueberries. Now, in this study, they didn't actually use blueberries. They used blueberry powder. So you do have to keep in mind that that is not exactly the same substance that we're putting in our bodies, but the idea is that we can extrapolate somewhat from their positive findings. And again, they found a really nice, robust effect on blood pressure. And this was specifically helpful in reducing people's peripheral vascular disease. This is the vascular disease that can build up in the feet. High fiber and whole grain cereals are particularly good for people who have just been diagnosed with high blood pressure when it's in its mild to moderate stage. There's a nice body of evidence showing that if you eat those foods every day, you're going to see a benefit in your blood pressure. I'm asking you to make these changes. Let's talk about how you're actually going to do it. The key to all behavior change is you have to define your motivation. I want you to think to yourself right now, why am I doing this? Psychologists who study behavior and motivation know that this is a critical step in getting you towards success. One of the most important things is your mindset. I really want you to have an empowered, positive mindset. Believe that we are going to do this. You are going to feel better about your brain health. You're going to know what to do. You're going to understand how different aspects of your life affect your brain. I want you to remind yourself of what you're going to do, not what you're not going to do. So if you can set up positive goals, I am going to eat blueberries 2 times per week. I am going to walk 5 days after lunch with my friend. That's a lot more helpful than saying I'm not going to eat sugar every day, or I'm not going to sit around and watch TV. I want you to really put things into positive terms. That's really going to help you. The other thing that I recommend is using a buddy system. Remember, social health is a critical part of brain health. So a lot of these recommendations are things that you can do with a spouse or a friend or a child, or if you're working in a residential community, these are things that you can bring to your residents that will truly improve the quality of their life. So what I want you to do is break out those behavior tracking sheets in the companion workbook, and I want you to start to keep track of your numbers. That is the first step. We need to know what are we doing now when we think about where it is that we need to go in the future. Thank you so much for joining me today. It was really a pleasure to teach you about brain health and heart health and how it all comes together. I hope you feel more in charge of your brain health now knowing this information and feel that you're really on the way to taking control. I really look forward to seeing you next time, and thanks so much for being here with me.